there is the abusive use of medications. That is, medications, for example, that have been developed for the treatment of attention deficit disorder. Kids now will take and sell and use as party drugs, and they'll combine them with alcohol or other kinds of illegal drugs like ecstasy. And the problem is these drug combinations are lethal. And we have many people in our world, young people into adulthood, who are overdosing and in some cases dying from lethal combinations of both psychiatric drugs as well as recreational drugs and illegal drugs. But a lot of it is prescribed medication. So these are really serious issues that I think we all are aware of, and we have to continue educating the public about.
In addition to these areas, one would have to include such things as phobias and post-traumatic stress disorder. Dr. Mitchell Scher is the director of the Phobia and Trauma Clinic at Hofstra and was able to give some great insight into these areas. According to Dr. Scher, phobias occur when common fears become excessive and interfere with doing certain activities. People may have phobias for different activities, situations, or objects. This list is in no way complete, but it is probably enough that at least one of you saw a photograph and identified with having an excessive fear of being around or doing one of these things. You may find when confronted with these situations or objects that you experience anxiety, dizziness, nausea, rapid heart rate, difficulty breathing, and a fear of impending doom. Fortunately, there has been great success in treating phobias with exposure therapy. Exposure therapy takes different forms. Imaginal exposure is a form of exposure therapy where a therapist guides a person through mental imagery situations so they can re-experience their avoidance or trauma. In virtual reality exposure, a computer-generated environment is utilized in a lab. These environments act to have people re-experience their fear and then overcome their fears and emotions. And finally, there is vivo exposure. People are put into real-world situations. For example, a person with a fear of elevators will be brought to an actual elevator. Exposure therapy has been very successful in treating phobias. At Hofstra's Phobia and Trauma Clinic, they've successfully treated hundreds of patients and published research journals on this matter. Also at the clinic, they treat people with post-traumatic stress disorder, or PTSD. Unlike phobias, where the behavior can be learned, PTSD is usually triggered when people experience life-threatening or highly unusual events outside the norm. Some examples of these situations are with tragedies including the September 11th tragedy. Those who have been raped may also suffer from PTSD. And what we have been hearing about more and more in the past few decades is the number of soldiers who suffer from PTSD after being in a war environment. Veterans from World War II have been diagnosed with PTSD, as have veterans returning home from Vietnam, Iraq, and Afghanistan.
When soldiers returned from Vietnam, America reacted very differently to them in general. It was a very difficult time in the country. And when they came back, from a social perspective, they were not necessarily welcomed back into society. People looked at men in uniform and they would spit on them and they would call them baby killers. And they were not welcomed back, even though these were their brothers and friends and people who just a few years earlier they had been in school with. It was a very different reception. And therefore, the ability to talk through your experiences, the ability to feel like you had done a good job serving your country, unfortunately didn't exist for many of these men. It's a very different situation now when we think about the soldiers serving in Iraq and Afghanistan, that while we may personally disagree on the wars and how they're being conducted, no one condemns the soldiers. In fact, everyone thanks them. And so that's a big issue that was very, very different in the Vietnam experience. Another issue that was very different was the sense of safety. There wasn't always a front line. In a more traditional war like World War II, oftentimes there were battle lines, and the further back you were, the safer you were. Vietnam was very much what was called a jungle war. There was the unpredictability of where someone would appear, when they would appear, how they would appear. Even in places that were safe, like the major cities, there were times and initiatives that happened that there really was no safety anywhere. So all of these kinds of issues contributed to why those particular soldiers had such a higher incidence of PTSD, or so we believe so.
How do you treat clients with post-traumatic stress disorder?
Well, in some sense, we treat those particular patients in the same way that we treat our phobic patients. The difference is they're going to be treated longer, and we're going to be dealing much more with other kinds of social issues. That is, while we're working on the exposure to get them comfortable and reintegrated into their lives the way they want to be dealing with their lives, we may also have to deal with issues about substance use, as I had said earlier. We may have to also work with them in terms of couples therapy or family therapy or whatever would be necessary to help improve their communications and to also have their loved ones understand them. Sometimes people find uncomfortable subjects something they just don't want to deal with. So a loving family member might say, I've just heard too much about 9/11. Just stop talking about it. You know, things are okay. You're okay. And they're not trying to be mean. They're trying to say, move on and help. But a person who has a reaction to that is a post-traumatic stress disorder can't simply move on because someone tells them to. So in fact, we might have to put them in a support group or a situation where they can talk openly and bring their spouse in and bring their family in so that they can really share the emotional burden that that person is experiencing. So it is done through primarily exposure work, but with additional ingredients or components as would be necessary for a particular person.
They say psychology is important from a cultural, medical, technological, scientific, and economic perspective. Can you elaborate on this?
I would be happy to elaborate on that if you gave me 2 hours. So what I will say is psychology really represents us as human beings. And the difference is it tends to represent us as individuals. There are certainly other studies of the social sciences, such as sociology and anthropology, looking at culture and looking at societal change, that also represent us. But there is no action, especially in those classes that you mentioned, whether it be economics, whether it be history, whether it be any other aspects of society, that there are not psychological aspects too. It's understanding psychology and thinking about how those aspects are applied. Those are the big questions. Psychologists have been called on to do things in everyday worlds that you might not have ever thought about. Why is the dashboard in a car laid out in a particular way? Well, there had to be an expert in an area called human factors who would say, when can you look with the eye and see things easily on the dashboard? Human factors is really experimental psychology. So psychologists are behind activities and actions you're unaware of. Years ago, I remember, and this was sort of amusing, in some of our journals, the question was, well, gee, we want to get people to use the new Poopa Scoopa laws and pick up after their dogs. How do you make that reinforcing for people? And there was a series of articles that came out in our journals talking about how to make these kinds of things reinforcing, how to get people to willingly be involved with exercise programs, how to get people to recycle in the environment. So it's not only just about, fixing people who have particular kinds of issues or problems, but the applications of society are found everywhere in our world.
If an individual is interested in becoming a psychologist, how should they choose whether to pursue a PhD or a PsyD program?
In comparing a PsyD and a PhD, you're really talking about 3 applied fields of psychology. Those fields are school psychology, counseling psychology, and clinical psychology. In any one of those 3 fields, you can get either a PhD or a PsyD. The essential difference is that a PhD in those fields means you are more of a scientist practitioner. That means that you are equally versed in how to do research in your respective field, collect data, work with it, publish it, and expected to do so, as well as you are to work in an applied way as a school psychologist, clinician, or counselor. A PsyD degree tends to be a practitioner degree. That is, the emphasis on science may be there in the respective graduate program in terms of background, understanding science, but less of an emphasis on the mechanics of research and the production of research. That distinction will vary quite a bit program to program, but that's the general distinction between the two.
Psychology has a long past, but a short history. And in that short history, there have been many theories about the human mental and physical processes. But again, I would like to thank Dr. Scher, and until next time, remember, science is appealing.